healthcare. What do you do about Obamacare?
Got to repeal it. It's got to end. It's a disaster. And don't forget, Obamacare doesn't really kick in. The negative impact doesn't kick in until 16. So Obama said, not only with certain companies and certain groups of people like Congress, as to getting Obamacare, he didn't want it during his administration. Very smart. One of the smarter things, frankly, that he's done. It kicks in 16. It's going to be a disaster. I believe in health care. You've got to take care of people. I have a big heart. I'm conservative with a very, very big heart. But Obamacare is a disaster. It's going to destroy the country. And it's bad, bad health care. It's horrible. So I would have a plan that would be a fabulous plan. But with all of that being said, you've got to take care of people. You have to repeal Obamacare. We have to come up with something much better and much less expensive, but at the same time better.
Obamacare, you call this the worst law of your lifetime.
Yeah, no
right?
question. It is.
No doubt.
No doubt in my mind. I was governor, and I dealt with the problem of the uninsured, and we did it in a very effective way that used market-based resources, and that helped to create a stronger economy. One of the reasons we haven't created the jobs and our economic recovery has been so slow is Obamacare. How many companies refuse to hire that next worker because that way they don't have to come under Obamacare? How many workers work 29 hours a week because if they work 30, they qualify under Obamacare? What was the tax? It was one of the largest tax increases ever imposed on the American people, and it's still incomprehensible. And by the way, I have a little business. Our health premiums that were supposed to go down, every family's going to save $2,500. Our health premiums went up by over 20%. You're not supposed to lose your health care if you like it. Millions and millions of Americans have had to change their policy.
Can you get Republicans to circle the wagons around one alternative to be opposite of Obamacare?
Sure, I think so. And I think the model that I had in New York worked very well. We had a great health care system, just like America did. But we had a problem, difficulty with the uninsured, and it wasn't the real low income. They had Medicaid. It was the working, lower waged people. It was small business entrepreneurs. It was a group that didn't have insurance. And we created a system through the private sector. We created a program called Family Health that allowed people earning $18,000, $20,000, $22,000 a year to access a very good policy at almost no cost. We created a program called Healthy New York, where entrepreneurs or small businesses or groups could pool together and access health insurance at low cost. And it worked, and it empowered the individual as a consumer. We had 32 different private companies competing